In the perfect world, what counselling should be offered alongside the testing?
It's important to say that the counselling we're talking about is not therapeutic counselling, it's genetic counselling, which is actually quite different, and the interactions are usually just one-off. So genetic counsellors are highly skilled, postgraduate educated, regulated professionals that register with the Genetic Counselling Registration Board. They're skilled in genomic medicine, clinical genetics, but also care of the family. So their job is to help families navigate their way through the testing. Who's going to be tested? What does it mean? How do they want to incorporate that into their lives? So that's what genetic counselling is. There's a very large space for genetic education, which is very different. So, and anybody could do that. So you just need to understand what genes do. Any health professional could do that. A website could do that. A chatbot could do that. But it's that interaction where you actually explore, what does this mean for you? Do you want to have your children tested? At what point could they be tested, and why, and what screening might they access if they're tested? It's that kind of holistic care that is genetic counselling. And I would say that as a discipline is what should be available when we're talking about really serious life-threatening conditions. And there's an opportunity here for genetic counsellors to really specialise in that, but to support their other clinical colleagues to have conversations about genetics when they're just dealing with a patient in front of them.
I think you mean serious high-risk conditions that are largely determined by genetics, because there's lots of serious high-risk conditions where it wouldn't be very predictive, and then I think...
we're talking about inherited conditions.
Yeah, so what you're doing is you're granting someone who's thinking about a test, undergoing a test, and post-test results access to a specialist that can formulate the nuance of the information that's coming in. Is there, or should there be, different levels, different steps of counselling depending on the generic test? Or should that, and I'm going to use this and regret it immediately, that gold standard of identified counselling be available for all generic testing because of the nuance that you're talking about and the change that's happening?
No, I don't think genetic counselling per se should be the gatekeeper to being able to access a genetic test, but it's context specific. So for example, if there's a woman with breast cancer who's going to see her oncologist and she has a diagnostic test for one of the breast and ovarian inherited genes, and she's found to have a mutation in one of those genes, that can be really relevant to determining the chemotherapy that she has and the surgery options that she has. And the oncologist could have a very sophisticated conversation about the fact we've done this test, this is what we found. But the oncologist is not going to say to that patient, okay, have you got any sisters? Should we test them now? When should we test them? Who else in the family is at risk? That would be somebody else who would be doing genetic counselling, who'd be doing that picking up of the pieces in time.
Rather than the generic test, it's actually the individual that the counsellor comes across that they can bring their expertise and knowledge to suggest wider review, research, or other questions that could be prompted. So I suppose the question, which flows from a lot of the information that we were given, that's a face-to-face discussion. I mean, I accept it maybe by telephone, but that requires a human interaction with the human that's undergoing it. So what are the panel's views on this idea of trying to get away with just written counselling or AI counselling or flowchart counselling? I mean,
that wouldn't be counselling, that would be information giving.
Yes.
Counselling has to be a two-way process, it's a dialogue, and it's patient-centred because it's focused around what the patient needs.
And I think our recommendation would be that counselling is recommended for the very high-risk conditions, but they are rare. So I don't think you would be calling for, and certainly the BSGEM wouldn't be calling for, counselling for all genetic tests. And when we're talking about the direct-to-consumer test, most of them will not be ostensibly for very high-risk conditions. So I don't think we're saying we think that is really mandated. What we are saying is that these consumers can find themselves getting what they think is high-risk information without ever having seen a counsellor, and they might have benefited from seeing a counsellor before they were in a position to get that information.
Yeah.